regional parliament.
All right, and a recap of our top story this hour, where Mombasa County health officials have issued an alert of an outbreak of the potentially fatal dengue fever.
This has been, we have 150 cases that were diagnosed in mostly private health facilities in the area. The County Health Chief Officer, Dr. Khadija Shikeli, says the disease has spread and affected all 6 sub-counties, with 119 cases confirmed at major private hospitals by yesterday.
Now, luckily, no deaths have been reported yet. Dengue fever is an illness caused by mosquitoes through sucking of blood from an infected person.
Symptoms of the disease include high fever, headache, rashes, nausea and vomiting. With heavy rainfall still pounding parts of the coastal region, warning has been issued to residents to report to the authorities in case signs are noted. Let's bring in Francis Ontomwa now, who joins us live from Mombasa. Ontomwa, reports that 150 cases have been diagnosed. What is the seriousness of this alert?
Coastal town of Mombasa here, and it has everything to do with that particular illness. Yesterday, Mombasa authorities were giving numbers at 150, some of the cases that have been found out at a mostly private facility. And we expect actually to get an official statement from Dr. Khadija Shikeli, who is the chief officer of the health docket here in Mombasa County, to really give us a clear statement on this particular issue. But as we understand right now, there is a bit of grippe that has, of course, affected mostly private facilities, and we are told that 150 cases of dengue fever have already been noted. And the most affected areas, Changamwe is leading, followed by Mvita, then there is Kisauni also, some of the 3 constituencies here in Mombasa County that has been worst affected. The last time dengue fever was actually witnessed here in Mombasa, and when it was actually in its worst, was in 2014, when 3 people actually succumbed. And therefore, just to show you that it is quite a serious illness, actually. My interaction with the public here in Mombasa, Michelle, actually indicates that very few people understand this particular illness. But just to give you a bit of a light on what dengue fever is all about, it is an illness that is transmitted by a special kind of mosquito, and this mosquito operates mostly daytime, and its effects are actually felt mostly during the mornings and around sunset. And just to also show you the kind of mosquito that you're talking about, it has white spots on its body. That is what experts are saying, and warning actually residents of Mombasa that they be keen on this particular issue, so that they are not, this disease actually is not transmitted further, because already we are recording 150 cases, 119 cases already recorded at private facilities. Dr. Khadija Shikeli will be making that statement actually later in the day, to be able to give a state of affairs, whether things have changed, the situation is getting better or getting worse, Michelle.
Right, and Ontomwa, do we know what the spread is within the coastal region? We do know that it's been reported there, but how widespread is it within the coastal region? Do we know?
Well, at this juncture, the only report that we are getting is basically here in Mombasa County. We are yet to get reports outside the Mombasa County on the other counties of the coast region. Therefore, at this particular juncture, the only information that we have is here in Mombasa. But this being, of course, one huge stretch, of course, we cannot write off, or rather, we cannot really rule out other counties also being affected. Kilifi, for instance, is is in proximity actually with Mombasa, and therefore this disease could have spread to other counties. But the report that we are getting at the moment is from Mombasa, where 150 cases have been reported, 119 being at the private facilities, Mike.
And then, Tom, of course, you mentioned earlier that people in Mombasa don't seem to quite understand what this disease is. But talk about the impact on tourism, because this is bound to affect tourism in the region.
Well, of course, yes, when you talk about such kind of conditions, such kind of illnesses, Mombasa really County gets worried in a way, because this is a tourism city, and much is, of course, the economy of this town really relies quite heavily on tourism. And when such information actually gets outside there, it causes quite a scare, especially to visitors, foreigners who are coming to Mombasa City. And therefore, this particular juncture, that is why perhaps health officials at the Mombasa County are really trying to race against time to really see whether they can be able to contain this illness actually in the right time. Well, it is actually compounded by the fact that it is actually raining heavily. Even as we are speaking right now, there are light showers already here in the city. And therefore, this particular, of course, as it continues to rain, it creates a breeding ground for mosquitoes. And that is why this particular issue may be actually be quite difficult really to handle at this particular juncture. The weatherman has already indicated that the rains actually, it's the long rain season here in Mombasa, and it could actually be extending in the next couple of weeks. And therefore, this is indeed quite an alarm to the authorities here to try and find a way that they'll be able to actually neuter this particular vice before it gets out of hand.
All right, and Francis, of course, the showers bring in a challenge because that provides a very healthy breeding ground for mosquitoes. But do we know what can residents do just to have the basic prevention measures put in place?
Yes, indeed. That is the report that was given by Shikeli yesterday. Yesterday, aside from trying to give a bit of statistics which she had gathered, she was trying also to send a warning to residents on some of the ways to really try and get out there and try and handle this particular illness. And some of the suggestions that she was making was that people to get outside there and to try and handle, especially to clear the environment around their houses, to clear empty bottles around their houses, to try and also try to remove any sort of breeding grounds that mosquitoes may want to take advantage of, so that they're able to handle this particular issue. So this particular juncture, largely, it's about warning, it's about sensitization, and as I've indicated earlier on, is the fact that dengue fever is not really well known to residents here. It is, of course, an ailment that portends itself, or rather brings out itself as if malaria. But when you go to actually, when you go for testing, experts say that malaria may actually appear negative in the results, but later on they come to establish that you have dengue fever. Therefore, at this particular juncture, a lot of public sensitization is going on, trying to tell the public on some of the symptoms to expect and what to do when they note these particular symptoms. But important is the fact that residents have been encouraged to go for testing and to also be keen on all these symptoms so that they're able to report them to the nearest health centers near their places.
All right, Ontoma, and finally, before we let you go, there's an interesting trend here. Of the 150 cases that have been diagnosed, most of them are in private facilities in the area. So what kind of treatment do patients with this dengue fever have to go through?
Well, at this particular juncture, we understand that there is a lot of testing that goes on when patients actually report symptoms that are closer to dengue fever. At this time, doctors are actually not taking any chances. They will, of course, do checkups for malaria and also do checkups for dengue fever, which are two distinct, actually, illnesses, also, although caused by mosquitoes, both of them caused by mosquitoes. Therefore, this time, there is a lot of checkups that go on, but the treatment that will be, of course, offered. It's a matter that, of course, I'm not really connoisseur to this particular issue, but this juncture, a lot of checkups are going on. And importantly, as I've indicated earlier to you, Michelle, important is for residents really to understand this particular condition, to understand what causes it and some of the symptoms to expect. And once they see them, what should they do? And being, of course, a rainy season at this particular juncture, there is a lot of information that is, of course, being circulated by health officials to try and counter this particular illness that is causing quite a panic here. Also, traders have been encouraged to also be keen around their places, because this particular mosquito that transmits dengue fever normally operates during daytime, and therefore traders, people in offices, in schools, at different places during daytime are encouraged to be